Hello, welcome to the Beasley Equine Podcast. I'm your host and equine veterinarian, Dr. Travis Beasley. In this episode, number 11, we're going to talk to you about something we see all the time at the clinic, something that could be affecting your horse, and if you're not looking, you're not going to find them. We're talking about peripheral caries on teeth, and we're going to talk about how these little things can have big impacts on your horse, how we treat them, most importantly, how we prevent them. And stay tuned to the end of the episode where we'll tell you how you could win free hay for a whole year from our sponsor, JustSayHey.com.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank and the penicillin.
So peripheral caries are a type of tooth decay on the side or the outer layers of cheek teeth. And it primarily affects the cementum, which is the bone-like tissue on the outermost part of the tooth. And this cementum provides structural support for the tooth, and also it anchors the periodontal ligament to the tooth, which is what holds the tooth in the socket. So very important structure, and anything that affects it can have a big effect on your horse and its tooth. And they can go even deeper than the cementum and get into the enamel, which is the strongest part of the tooth, but it's also pretty brittle. Once they get in there, we see some big problems. And we did 4 or 5 floats today. I think about half of the horses we diagnosed peripheral caries and treated them and talked about how to prevent them with our owners. So they're out there, and if you're not looking, you're not going to catch them. If nobody's using a mirror to give your horse a thorough oral exam and they don't know what they're looking for, then find somebody that can find these and knows how to treat them. And the other day I had a client tell me they've never seen anybody use a mirror when doing the oral exam. So make sure that you're not just having somebody go in there and knock the points off your horse. Make sure somebody that knows what they're doing is getting in there and looking at the teeth structures to try to prevent problems down the road. So these peripheral caries, which are cavities on the side of the teeth, can vary in severity. They can be anywhere from mild to severe. Mild is just the real superficial ones that you're just starting to see some pitting in that cementum or the outside of the tooth. You can have moderate ones where the cementum's almost gone and it's stripped down to the enamel, and the enamel's starting to get infected or affected. And the severe ones are really deep, and now we're getting into the dentum or the inner layer of the teeth. And these are the ones when horses' teeth start to crack. So if somebody tells you, oh, your horse just has brittle teeth, you need to have peripheral caries on your mind. And we do grade these real similar to stomach ulcers, 0 to 4. 0 is a completely normal tooth. 4 is when they start to crack and you're losing that structural integrity of the tooth. But it's not important for you guys to know the details. But there is a grading system if you hear that mentioned. So how do these happen and why do they happen? Horses have, and I'm assuming people do too, what we call a biofilm in their mouth, which is just a fancy word for the oral fluid that's in the mouth and surrounding the teeth. And this biofilm is really rich in mineral. There's a lot of calcium, phosphate, and even fluoride and saliva and normal bacteria in the mouth. So, and there's a normal, what we call demineralization of the tooth, where a little bit dissolves and gets into that biofilm and then flows back to the tooth. There's that normal ebb and flow of this. And when we start to get more demineralization than we can put back, that's when we start to see these cavities. And for peripheral caries to form, we need 2 things. We need acid-producing bacteria, and we need carbohydrates in the diet that acid-producing bacteria can ferment. And that's very important to remember when we talk about preventing these later. We need acid-producing bacteria and fermentable dietary carbs for peripheral caries to form. So what happens when your horse eats carbs? The bacteria in the mouth is going to ferment these and produce acid. And that acid's going to build up over time. And then that biofilm I mentioned earlier becomes too acidic. So when we look at the acidity, neutral is 7. A pH of 7 is neutral. If we go a little bit higher, that's more basic. As the pH drops, that's more acidic. And at 6.7, if the pH is 6.7 in the mouth, that's when the cementum can start to decay. And the lower that pH gets, or the more acidic it gets, the deeper into the tooth it can affect. So That's also important to remember when we talk about the prevention. So when we talk about prevention, we need to remember that 6.7 is kind of that critical pH, and that we got to have bacteria that ferments carbs, and we got to have the carbs in the diet that they can ferment. So the other factors that can contribute to peripheral caries are, I mentioned there's saliva in that biofilm. So if there's something that has affected the saliva flow in your horse, whether an injury or some congenital or genetic defect that reduces the saliva, we see an increase in these peripheral caries, because saliva actually has a lot of bicarb in it. When we talk about stomach acid and stomach ulcers, the bicarb buffers that. And same thing in the mouth. So if there's a low buffering capacity of the saliva or biofilm, these peripheral caries are more likely to happen. And also if there's inadequate mineralization or mineral content in the saliva and the biofilm. So we know that saliva is very important, and that's one of the protective factors of this. And then we can also do antimicrobial mouth rinses and fluoride, and we can reduce the carbs that they intake, the fermentable carbs, and the remineralization of fluoride, calcium, and phosphate in the oral fluid. So those are the things that we can use to protect these teeth from peripheral caries: saliva, antibacterials, reduction in the intake of fermentable carbs, and helping the horse remineralize these teeth by providing some fluoride, calcium, and phosphate. So horses that have had an injury to a salivary gland, it's usually one-sided, or what we call unilateral, and usually just that side of the teeth are affected. So there's no saliva flowing, and there's nothing to protect the stuff in the saliva that bathes the tooth. There's no protection from the saliva on that side that there's an injury. So why do we care about these? Why is it a problem? Because the horses have that thick layer of cementum. It's only about 65% mineral, and the peripheral cementum, that outside layer that's the first one to get affected, contributes to the size and strength of these teeth. And the enamel, the under the cementum, is super hard, but it's also super brittle. So without the support from the cementum, that's when we start to see tooths crack and fracture. So the cementum is a super important structure in your horse's teeth. And if they get these peripheral caries and it starts to decay, then we got tooth loss. And that gives food a great place to pack. And that's where we can see some gaps get in between teeth from the decay and food pack, and we can get diastemas, which is a gap between the tooth where feed's packing, and that can lead to periodontal disease and pain. And these can increase the rate of wear on the grinding surface. So the horse has a very rough grinding surface, and you hear horses getting older and having a smooth mouth. That's because that grinding surface, there's no more tooth to erupt, and the grinding surface has become smooth. And if your horse has peripheral caries, it can lead to the increased rate of wear of the grinding surface. So the long-term consequence of some of these is, instead of the horse running out of teeth when they're in their mid to late 20s, they can actually run out of tooth in their mid to late teens and decrease their longevity of life. So when we do the oral exam, I take a mirror and look at every side of the tooth. And what these look like are little pits on what we call the clinical crown. And the crown is the part of the tooth that's inside the mouth. If anybody's had a root canal or that's required a crown, that's where that name comes from. It's the part of the tooth that's in the oral cavity. The good thing about peripheral caries is it doesn't affect the unerupted tooth. So horses are born with their whole tooth, and they don't continually grow, but they continually erupt. So that horse's tooth is continually getting pulled down into the mouth. And because it doesn't affect the tooth that hasn't erupted, we know it's not a genetic disease. So the excuse of, a horse just has bad teeth, it's genetic, a lot of times it's peripheral caries. And they look like those little pits on the side of the teeth. And a lot of times they'll be kind of gray, they'll be stained, there'll be food stuck in them. So that's why it's really important to get in there with a mirror and a bright light, or even a camera that we stick in the horse's mouth. When they look at these under histopath, or when they look at them close up, like under a microscope, they'll see a thick layer of plaque and a biofilm adhering to the tooth. And that biofilm is full of bacteria. And the horses with peripheral caries, the bacteria is actually going into the cementum. So when they stain these sections of the tooth and look under a microscope, there's bacteria in the cementum. And then the tooth is also demineralized, like we talked about. They can see that. And looking at a horse just inside the mouth with a mirror, a lot of times we do underestimate these things. They may not look too bad, but what some studies and literature showed us is the ones that don't look too bad on oral exam may be even worse than we can realize when they take these teeth. And to do this, the histopath I'm talking about, these are on deceased horses. That's the only way or a tooth that's been removed because of complications. So it can even progress to get down to the pulp, and you can get pulpitis and tooth loss. And then it's more similar to a cavity like we have, where it affects the sensitive part of the tooth, and that's a very, very significant condition. The bacteria that's mainly caused these, we don't know exactly, but the Streptococcus species are associated with peripheral caries in people, so we assume it's most likely those in horses. But that's not that important, because the way we prevent these and treat these, it doesn't matter exactly what the bacteria is. So I mentioned earlier that the decay and tooth loss can get bad enough that we can get periodontal disease. So periodontal disease is basically gum disease. Same definition as people. It's a disease that affects the gum and the structures that support the tooth, and that's including bone. Everything, the structures that support that tooth and the bone can get inflamed and infected, and it's the leading cause of tooth loss in the horse industry. And there's a very high statistical link between peripheral caries and periodontal disease. If your horse has gingival recession, or if your horse has these peripheral caries, they're interrelated. You're 4 times more likely to have feed accumulation and gingival recession if your horse has peripheral caries than if they don't, and vice versa. If you have feed accumulation between your horse's teeth, they're 2 times more likely to have peripheral caries. So these things kind of go hand in hand: periodontal disease, feed packing, and these peripheral caries or cavities on the side of the teeth. So what are the risk factors of these? Just say hay. Hay is one of the biggest risk factors, the dietary carbohydrates of hay. And that's very variable between different types of hay. If you look at alfalfa, and every hay test's different, but if you look at alfalfa, it's about 6 to 8% carbs. Grass hay is about 10 to 12%. So less carbohydrates can be protective. So it's important in these guys to test the hay, because you cannot just look at the hay and see it. Some of this, what people will refer to as low quality hay, may have a lot of these fermentable carbs in it. And if you do get your hay tested, we want low water soluble carbohydrates. The other way you can think of these are non-structural carbohydrates, basically sugars. The ones that dissolve easy in water and they dissolve easy in the mouth, and the bacteria can ferment them. So test the hay. You want low water soluble carbohydrates or non-structural carbohydrates. On some reports, it'll be NSC, non-structural carbohydrates. The other risk factor we see is water sources, and that comes back to what I mentioned earlier about the pH. So groundwater from a well, about 7.4 pH. And also the water from the ground has about 70 times more mineral content than rainwater. Again, if we have a lot of mineral content in the water, there's more mineral to bathe that tooth and remineralize it and make it stronger. If we look at drinking water, from your faucet city water, on average, it has a pH of 7.9, so even better. But it only has 36 times the mineral content versus rainwater. So a little bit less than groundwater, but the pH is a little bit better. Now, a lot of people around here do collect rainwater for horses, which seems like a really great economical thing to do. But rainwater on average has a pH of 5.9. So remember that 6.7 pH is what can affect the cementum. We're way below that at 5.9. So we want water with a high mineral content and a higher pH. So the groundwater or drinking water is probably the best thing. Ponds and streams and stuff like that can vary a lot, so it's important to test it. We recommend the little pool testing pH strips to give you a pretty good idea. You're not going to get it exact, but it'll give you a good idea whether you're close to the pH of 7. We really want it closer to like 7.5 if you're testing these things. If you do test your water and it is acidic, we can add sodium bicarb or baking soda to it, and you can just add it and mix it up till we bring that pH up closer to 7.5. And then make sure your horse drinks it with it. It shouldn't affect the taste that much. Some of them even acquire a taste for it. So the way we treat these is, the good news is we can treat them. It is a reversible disease because the tooth below the gum that's going to end up erupting and end up in your horse's mouth is normal. We know that. So what we have to do is stop the tooth from getting destroyed even longer, and then let that tooth erupt. And we got to get rid of that old thinking that your horse just has brittle or bad teeth. It's not a genetic disease. With that being said, maybe saliva components, maybe there's some genetic disease there, but most of the time, peripheral caries are not genetic. It's an environmental thing, either the feed or the water. So what we can do is manipulate the environment in the horse's mouth and reverse these things and remineralize them. People always ask, how long have they been there? I just got this horse. It's really hard to age these things, but we do know that they can start. You can have a normal tooth, and in as little as 3 weeks on hay with a lot of fermentable carbs, 3 weeks eating that, you can have peripheral caries. But they may kind of plateau, so it's really hard to age these things. So if your horse has these, we got to try to figure out what is causing it. It's got to be the sugar or the acid in the diet. And you can, if say your water does test a little bit acidic, you can treat that and then recheck your horse, make sure they're getting better, and then you got your answer. Or you can test the hay and replace that. So treatment and prevention is important with these guys. Decrease the fermentable carbs, decrease the acidity of the water. And we don't treat the peripheral caries themselves too much. We're not filling them like you would go get a cavity filled at the dentist. We're treating the secondary issues like the periodontal disease, where we got to flush the pockets out between the teeth. I apply fluoride varnish, the same if you've ever had fluoride done at the dentist. They say they're flavored, but they taste terrible and they leave that nasty sticky film in your mouth. I buy these from a local dentist, and that's how I treat these. I put the fluoride on there. There's not much evidence in horses that it works that great, but in humans, it's very, very effective, and it's super sticky and sticks to the side of the horse's teeth and will last about 6 months. So while we're figuring out the dietary causes of these things, I will put fluoride on these horses' teeth to make sure that takes care of them. And for the really low grade, the very, very mild ones, sometimes we'll go a year before we recheck them. And that's where the oral endoscope or the camera we put in the horse's mouth is good. The records are good. That way we know what we start with, and then when we recheck, we can know if they're getting better. And you can also look and see if the newly erupted tooth has got them too. Then we kind of know we're nipping in the bud. If the tooth that's erupting into the horse's mouth is normal, we know that our modifications are working. And it's multifactorial, meaning there's multiple factors that do it, because we'll have horses come in that are managed the exact same way. They all get the same feed. They're all in the same pasture. They all drink the same water. Some will have them and some will not. So that's how we know it's not 100% every horse. It's the bacteria and the biofilm in the mouth, and maybe the composition of the saliva. I said that these brittle teeth are not genetic, but if there's some genetic component, it's got to be the saliva. And we'll change the factors that we can, the diet and water. We'll add the bicarb, and it's pretty easy to prevent these things. So peripheral caries are cavities and tooth decay on the side of your horse's tooth caused from either drinking really acidic water or having a lot of fermentable carbs in their diet or non-structural carbohydrates like sugars. So make sure if your horse is getting a dental float every year, make sure it's getting an exam to look for these things and prevent problems down the road. They'll decrease the lifespan of the teeth, which can decrease the lifespan of your horse. And I want to thank our sponsors again for this, justsayhay.com. And it's very exciting right now because they're doing a drawing for free hay for 1 year for one horse, which they've calculated to 10 3x3 alfalfa bales, which is awesome. They're going to draw May 1st at noon. They're also going to give away 5 bales to one winner. And one winner is going to get a free oral exam and float here at Beasley Equine Clinic. And if your horse has peripheral caries, we'll even throw in a free fluoride treatment. And they're going to give away 10 Just Say Hay hats. So go to justsayhay.com. It's right there as you pop on their homepage. Click to enter, and maybe you'll win free hay for a year or get to come see us for a free dental and oral exam. So until next time, take care of your horses and yourself.
Veterinary surgeon or start to come quick. Draw the syringe and give it a flick. Bring your little black bag with the medicines in. Bring the trank and the crank.